Number 2, Mr. Speaker.
Thank you, Mr. Speaker. And despite my best efforts, can I welcome the member for Runcorn and Helsby to her place? Being a Member of Parliament is a privilege, and I know how special it is to sit on these benches, having been sent here by constituents, and regardless of political differences, wish her well personally. Mr. Speaker, with permission, I'd like to take questions 2 and 14 together. Mr. Speaker, as part of our 10-year plan for health, we want to deliver a real shift in the centre of gravity in the NHS so that people get more care closer to home, indeed in their home too. The NHS has much a neighbourhood health service as a national health service. We've already made progress in shifting care to the community, £889 million more in funding for GPs, agreeing the GP contract for the first time since the pandemic, and recruiting over 1,500 GPs onto the front line. Our 10-year plan will set out how we will continue to transform the NHS into a neighbourhood health service.
Thank you, Mr. Speaker. I'm deeply concerned about the quality of healthcare for people experiencing homelessness in my constituency, Bournemouth West. Health Bus, a local charity, is doing great work to get out into the community, to treat people where they are and prevent them from getting into hospitals. But they are not getting the funding they need and have discovered serious discrepancies in the way the local ICB commissions services, particularly for health inequalities. So can the Secretary of State tell me how this government is prioritising health outcomes for people experiencing homelessness, and will he meet with me and Health Bus to discuss how we can support their important work?
Secretary of State.
Mr. Speaker, it was the founding mission of the NHS to always be there for people when they need it, so that whenever they fall ill, they never have to worry about the bill. And unfortunately, too many people in our country today experience that fear that Nye Bevan sought to eradicate, thanks to the disaster and the failures of 14 years of Conservative government. As my honourable friend would expect, tackling health inequalities for homeless people and other vulnerable groups is absolutely central to the values of this Labour government, and those values will be reflected in our 10-year plan for health, and I'd be delighted to hear further from her on what we can do to improve services in her area.
Your plan.
Thank you, Mr. Speaker. And I want to thank the Minister for his announcement this morning regarding GP services. And one way pressure is eased in our GP services is through organisations like Compassion in Action. It's a charity in my constituency that provides non-clinical whole-person care. So they receive GP referrals across Lee and align with the government's aim to shift care from hospitals to communities. So will the Minister join me in thanking the staff and founder Pam Gilligan and agree to come for a tour to see the facilities and to see firsthand the impact that they have?
Thank you, Mr. Speaker. I wholeheartedly join her in thanking Pam and everyone at Compassion in Action for the work that they do. I think at the heart of this government's approach to health is a recognition that government action is essential for improving health outcomes in our country, but government acting alone will not be sufficient. That's why working with the voluntary sector, working with employers, working with trade unions, community groups, and actually all of us as individual citizens is vital for tackling health inequalities and improving care in our country. And I'd be delighted to make sure that one of the team comes to visit as soon as we possibly can.
Stuart Anderson, welcome back.
Thank you, Mr. Speaker. Community hospitals can reduce pressure on major hospitals, especially in rural communities like mine. Will the Secretary of State lay out his plans of how he intends to support community hospitals in South Shropshire?
Well, Mr. Speaker, at the heart of this government's approach is investment and reform of the NHS to make sure we deliver better outcomes for patients. That means the biggest devolution of power in the history of the NHS, with more decisions taken closer to patients and their communities, indeed more power in the hands of patients too. Community hospitals do have a vital role to play, and no doubt, thanks to the decisions taken by this government to deliver £26 billion more into our NHS, we'll be able to make further and faster progress, opposed by the party opposite.
Susan Berry.
Thank you very much, Mr. Speaker. In my constituency of Mid Dumbartonshire, there's an ageing population in need of local healthcare services. Will the Secretary of State meet with their Scottish counterpart to discuss the need for increased access to community healthcare, specifically the need for a new health and care centre within my constituency of Mid Dumbartonshire? Thank you.
I'm grateful to the Honourable Member for her question. She'd be delighted to know that only last week I met with my counterparts in Scotland, Wales and Northern Ireland to talk about how we can work together to improve health and care throughout the United Kingdom of Great Britain and Northern Ireland. She will know that health is devolved, but thanks to the decisions taken by this Labour government, the Scottish Government has just been delivered the biggest financial settlement since devolution began, which might mean they might finally make some progress on their waiting list, where 1 in 6 Scots are on a waiting list, and the SNP are on to their 5th NHS reform plan in 4 years.
It's coming down. Alex Ballinger.
Question number 3, Mr Speaker.
Minister.
Thank you very much, Mr Speaker. I'm very pleased to tell my honourable friend that we've recruited over 1,500 additional GPs since October through an investment of £82 million, helping to fix the front door to the NHS. And today we've announced £100 million of funding that will unlock new capacity and more appointments in GP surgeries, and we've also launched a red tape challenge and scrapped unnecessary targets in our new GP contract to cut down on bureaucracy and free up time to spend with patients.
Speaker, my constituents in Hale Zone have written to me time and again complaining that they are calling at 8 a.m. Their GP surgeries as instructed, but they are still unable to get a same-day appointment. So can the Minister set out for my constituents how this £100 million investment in GP surgeries, consulting rooms and other facilities will finally put an end to this frustrating 8 a.m. scramble?
Minister.
Well, I thank him and absolutely share his frustrations and the frustrations of his constituents. The investment that we've made today was in response to GPs telling us that they needed more space, leading to more capacity, leading to better access and better outcomes for his constituents. Of course, today's announcement was only possible thanks to the decisions made in the October budget, which were opposed by every party opposite. So the choice is clear: investment in our NHS with Labour or cuts with the Tories and reform.
Rebecca Smith.
Thank you, Mr Speaker. My constituent, Dr Toby Nelson, an NHS consultant dermatologist, has started a business that seeks to address the heavy demand on primary care for skin health screening. His business, Map My Mole, sends an image capture kit to patients to attach to their smartphones. The patients then send the high-resolution image remotely to be reviewed by a specialist consultant, bypassing the need for a GP appointment and freeing up time and resources for both doctor and patient. It's already resulted in a significant drop in skin cancer referrals in pilot GP surgeries. So will the Minister agree to meet with Dr Nelson and I to discuss this revolutionary proposal?
I thank the Honourable Lady for that question. She raises what sounds like an extremely interesting scheme. She will know that we've got a strong commitment in our 10-year plan to shifting from hospital to community and indeed from analogue to digital, and the digital aspects of what she just said sound very interesting, so I'd certainly be more than happy to take further representations from her.
Number 4, Mr Speaker.
Minister.
Thank you, and I thank my honourable friend for that question. She is an outstanding campaigner on this issue, as I'm sure everybody across this House is aware. She will know that the NHS England Accelerator pilots have shown how improved IT connectivity and a single point of access can speed up eye care referrals and allow more patients to be managed in the community. It's a great example of that shift from analogue to digital that we want to make. We're developing the 10-year health plan with input from the public, from our partners and health staff, and which of course includes the eye care sector.
Thank you, Mr Speaker, and I thank the Minister for his response. And can I say I welcome all the work both he and the Secretary of State are doing in rebuilding our NHS. But we know that there is a capacity crisis within eye healthcare. NH ophthalmology continues to be the busiest and largest outpatient service. And we know that essentially what's leading to many people are ending up not getting seen soon enough, and which is resulting in many of them losing their sight unnecessarily. So what we need is a joined-up healthcare plan. So will the Minister agree to ensuring that eye healthcare will be part of the government's wider 10-year health plan?
Well, I thank her for that question, and she's absolutely right that early intervention is crucial. The interface between the high street and secondary care is a vitally important part of that, and that means having a joined-up eye health strategy. The 10-year plan will absolutely have that joined-up strategy.